CNA Resident Rights Advocacy. Welcome to the quiz. Question 1. You are providing oral care to an unconscious resident. To prevent aspiration, what is the single most important step you must remember? Option A. Position the resident on their side with their head turned to the side to allow fluids to drain out of the mouth rather than back into the throat, and use only a small amount of non-foaming toothpaste or a suction toothbrush. Option B. Use a firm-bristled toothbrush to ensure a thorough cleaning and remove all plaque. Option C. Use a toothpaste that creates a lot of foam to loosen debris and ensure the mouth is clean. Option D. Position the resident on their back with a small pillow under their head to keep their airway open. The answer is A. Side positioning allows gravity to drain fluids and prevent aspiration. Option A is correct because side positioning allows gravity to drain fluids out of the mouth, preventing aspiration. Option B is incorrect because a firm brush can injure gums and aspiration risk is not addressed. Option C is incorrect because too much foam increases risk of aspiration. Option D is incorrect because lying on back increases aspiration risk. Question 2. A resident who is Jewish and observes kosher dietary laws is served a meal with a cheeseburger. What should you do? Option A. Explain that the cook made a mistake, apologize, and remove the tray immediately. Offer to get them an alternative meal that complies with kosher laws, such as a kosher-style meal or a fish option, and notify dietary of the error. Option B. Tell them to just eat the burger and leave the cheese, as the main protein is the most important part of the meal. Option C. Say a quick prayer over the food to make it acceptable for them to eat, then encourage them to enjoy their meal. Option D. Ask them if they would like ketchup or mustard for their cheeseburger to make it more palatable. The answer is A. Respecting religious dietary laws is essential for culturally competent care. Option A is correct because it respects the resident's religious dietary laws by removing the non-kosher meal and providing an appropriate alternative. Option B is incorrect because mixing meat and dairy is against kosher laws. Leaving the cheese does not make it kosher. Option C is incorrect because prayer does not change the food's non-kosher status. Option D is incorrect because it ignores the dietary restriction entirely. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. During your morning rounds, you find a new resident, who is usually alert and oriented, crying softly in bed. When you ask what's wrong, they say, "I just want to go home." What is the most supportive initial response? Option A. This is your home now. You need to try to adjust and make the best of it. Option B. Sit down next to them, make eye contact, and say, "It sounds like you're feeling really sad and missing your home. That must be so hard. Would you like to talk about what you miss the most?" This validates their feelings and offers a listening ear. Option C. Distract them by telling them it's time for breakfast and they need to get dressed and come to the dining room to socialize. Option D. You'll get to go home soon. Don't worry. This is just temporary. The answer is B. Validating feelings and offering a listening ear builds trust and rapport. Option A is incorrect because telling them to adjust dismisses their grief. Option B is correct because it validates the resident's feelings and offers emotional support without dismissing or arguing. Option C is incorrect because distraction avoids addressing the emotion, which may be needed. Option D is incorrect because false reassurance may not be true and minimizes their feelings. Question 4. When providing passive range of motion, PROM, exercises to a resident's shoulder, at what point should you stop the movement? Option A. When the resident says, "That's enough," even if you have only done a few repetitions. Option B. At the point of resistance or the moment the resident reports any pain or discomfort. Support the joint above and below, move slowly and smoothly, and never force a joint beyond its comfortable limit. Option C. after moving the joint through its full range 10 times, regardless of feedback, to ensure the exercise is effective. Option D, when you feel significant resistance from the joint, even if the resident is not complaining of pain. The answer is B. Stopping at resistance or pain prevents injury during prom. Option A is incorrect. While respecting the resident's wishes is important, the primary indicator is pain or resistance. Option B is correct because forcing a joint beyond resistance or pain can cause injury. Option C is incorrect because counting reps regardless of feedback can cause harm. Option D is incorrect because resistance without pain may be normal, but you should not force. You stop at resistance. Question 5. A resident has an order for a clear liquid diet. Which of the following meal trays would be appropriate to serve them and why? Option A, a cup of broth, a small dish of applesauce, and a glass of water. Applesauce is a pureed solid, not a liquid. Option B, a cup of black coffee, a bowl of gelatin, and a can of ginger ale. These are all clear liquids that are liquid at room temperature and leave little residue. Option C, a glass of milk, a cup of tea with cream and sugar, and a bowl of ice cream. Milk and ice cream are not clear liquids. Option D, a bowl of chicken noodle soup, a grape popsicle, and a glass of apple juice. The soup has solids. The answer is B. Clear liquids are transparent and liquid at room temperature. Option A is incorrect because applesauce is a pureed solid, not a liquid. Option B is correct because black coffee, gelatin, and ginger ale are all clear liquids. Option C is incorrect because milk and ice cream are not clear liquids. Option D is incorrect because chicken noodle soup contains solids. Question 6. You are helping a resident dress after a shower. They have left-sided weakness from a stroke. In what order should you put on their clothing and why? Option A. The order doesn't matter as long as they are dressed. Focus on their comfort and modesty. Option B. Start with the left, weaker, arm and leg, then the right. This allows you to manipulate the weaker side first while the resident can still assist with the stronger side, and it makes undressing easier later by reversing the order. Option C. Start with the right, stronger, arm and leg, then the left. This is easier for you and faster for the resident. Option D. Put both arms in the shirt at the same time to save time and minimize discomfort. The answer is B. Dressing the weaker side first is standard for hemiplegia care. Option A is incorrect because order does matter for ease and safety. Option B is correct because dressing the weaker side first allows you to maneuver the limb while the resident can still assist with the stronger side. Option C is incorrect because dressing the strong side first makes it harder to dress the weak side. Option D is incorrect because it's impractical and may cause discomfort. Great job! Don't forget to subscribe. Bye!